Cool. So welcome everyone to our second webinar in our Applying for Radiology series. This is about how to prepare for the MSRA. For those of you who don't know, my name's Jack. I'm a Radiology Registrar at University College Hospital.
And I'm Jakob, an ST1 Radiology Registrar at University College Hospitals as well.
Just to say that a lot of the information is also going to be on our website, which is ace-radiology.com. If you haven't already, join our mailing list. The link's on the website because nearer the time we'll post some tips about things like for the interview and also future webinars that we have. So the structure of the talk today is going to be 1 hour. The first bit's going to be about what the MSRA exam is. And then we'll move on to the sections of the MSRA, which includes the clinical problem solving section and the professional dilemmas section. And within that, we'll tell you how to prepare for these sections and talk a bit about the structure of the questions as well. And then at the end, we'll go through any questions that you have. And as Jakob said earlier, leave any questions in the chat, and then we'll talk about them at the end so that we can make sure we get through the presentation.
What is the MSRA, which stands for Multi-Specialty Recruitment Assessment? I know you guys are all worried about this, and it's probably the bane of your life at the moment, but don't worry, we're going to go through it and hopefully make it a bit easier for you to help tackle this exam. So it's an exam that's allegedly validated and has been used since 2013 or 14. It initially started off with a few specialties, and then other specialties caught onto it. Essentially, the MSRA is used as a shortlisting tool or recruitment tool for a part of the recruitment process of the respective specialty you're applying for. The points you get on the exam then give your overall point at the end. So some of the list of the specialties you can see on the list on the screen now. Obviously, clinical radiology has been using it for a long time, and so has GP and core psychiatry. The newest addition this year, some of you might be applying, is core surgical training. As I mentioned, most specialties nowadays are using this, and they weight the score you get from the MSRA differently. So radiology has always been between 30 and 40%, depending year on year, and this is subject to change. Always account for regular news from HE or clinical radiology email. Anesthetics has always been around 15%. Surprisingly, GP and psychiatry are the only two specialties where MSRA is the only thing that matters. If you score really well in the MSRA, that's all that matters. You don't need any portfolio, or you don't go through an interview process. Your score determines your rank. And then the newest addition this year, as I mentioned, is core surgical training, which this year apparently their weighting MSRA is 10%. And that's only, as you can tell, only a small part of the whole final score. Neurosurgery and ophthalmology have used it for years, and so has obs and gynae. Now, specifically, as this is about radiology, we'll talk about radiology cutoff scores. So for 2021 to 2022, it was used as a shortlisting tool to shortlist the top 600 scoring applicants to go to the next stage, which is the interview stage. As you can see, around just shy of 1,700 candidates applied for 350 posts. And out of that, just below 600 were actually interviewed. Year on year, the cutoff score that you need to actually get an interview changes. So for radiology last year was around 530. As the application process went on during that year, this slightly go down, so that up to 600 candidates were eventually interviewed. And the way they do this, I'm not sure if most people are aware, the score you get depends on how well other candidates in that sitting achieve. So the whole sitting, so from the beginning to the end. And they use this algorithm or mathematical equation and form a graph and form a median in the middle. And apparently 500 is sort of the middle cutoff where most candidates score, and 530 for radiology was how much you would need to get an interview. I understand for things like GP and psychiatry, it's a bit less when they had interviews back in the day. But yeah, do look at the respective specialty websites, and they will possibly tell you what the cutoff was, or speak to trainees in that respective specialty. The MSRA window this year is between 5th and 7th of January 2023, meaning you should, in the next couple of weeks, get invitation from Pearson View which is essentially a driving test centre where you'll actually sit this exam, and then you pick a date and sit the exam on that date. So the actual exam is made of 2 parts. First being the professional dilemmas. This is made out of 50 scenarios or 50 questions. And actually from that 50 questions, only 42 go to your final score point, or your final point, and 8 are used as pilot questions for future exams. And you have around 95 minutes to complete the exam. Following that, you've got the clinical problem solving part of the exam, which is made up of 97 questions. And from the 97, 86 actually used to score, with 11 being pilot questions again for following years. And you have around 75 minutes, so considerably less time to answer all 97 questions. So it can be quite stressful. So it's very important to start revising early on. So technically, the exam is set at a foundation level. So you should be able to sit, you should be technically ready to be able to sit it. But it goes without saying, you know, I personally believe, especially the professional dilemma section, is a bit of a lottery. You know, 2 different, you know, people who actually come up with the questions, you know, examiners don't really agree on the right or wrong answer in regards to the professional dilemma part. But I 100% believe you can tackle this and get really good scores through the revision techniques. All the questions are based on the generic professional capabilities set out by the GMC. So it's very important to go ahead and read that as you're revising, as you're doing these questions, because, you know, all the questions all the scenarios will based upon that. And the scenarios you'll come across will essentially be things you'll see in your daily practice at work.
Great, thanks, Jacob. So I'll start by talking about the clinical problem solving section. The reason we're starting with this is because we believe this is the part that you can have a bigger impact on your score with. So the section is a bit like your final year medical school exams, where it's based on various specialties, which you can see up on the screen now. And you'll get a certain number of questions that will cover each of these topics. When you look at the the MSRA blueprint, we've put the link to that. Well, it's at the end of the presentation, but also on our website in the MSRA section, which essentially details how the exam is laid out. What they're aiming to test in this particular section is essentially applying your medical knowledge to managing sort of diagnostic and treatment problems with patients. So, for example, we're covering things like investigations and also managing certain medical conditions, either through prescribing or through emergencies as well. This is all outlined in the blueprint. Let's talk a little bit about how some of the questions are structured. So there's essentially 2 possible structures for this section. One is the extended matching question, and for this you'll at the top you'll see a few diagnoses. Following that, you'll have a couple of questions of which the answers are in the top. So this question is from the MSRA blueprint, and interestingly, they don't provide an answer for this, but it is a good example. If I just talk through it. So, for example, if we look at the first question, and always make sure, of course, to read the question, because sometimes they throw in some funny sort of words or phrases. So they're asking for the single most likely diagnosis. In this case, you have a combination of tremor, breathlessness, and tachycardia. Sometimes they will give you a few diagnoses that could all potentially fit with the answer, but you have to pick what you think would be most likely. So, for example, in this thing, Yap and I were talking through this one. We think probably it might be hypothyroidism. So that's associated with a fine tremor and some tachycardia. You might be getting breathlessness from goiter compressing the airway. Then for the second question, just as another example, 44-year-old woman developing tingling in her fingers 3 days after a total thyroidectomy for a papillary carcinoma. Having tingling in the fingers would immediately make you think about hypocalcemia. And then when you think about a surgery, which is a thyroidectomy, within the thyroid gland or just behind the thyroid gland are the parathyroid glands, which produce parathyroid hormone. which would normally be responsible for raising your serum calcium. So if I had to develop hypocalcemia, would fit with a hypoparathyroidism, secondary to removal of the parathyroid glands. So you would put that as the most likely diagnosis. So the other type of question would be a single best answer, which is where you start with a vignette, in this case a student with chest pain and dyspnea, and then you simply have to pick the most likely diagnosis from the options that they've provided. So looking through it, they have chest pain, dyspnea, trachea deviated to the left, and hyperresonance on decreased breath sounds on that side. So you're immediately thinking about things like, I guess in this case, a pneumothorax. Some of the top tips for clinical problem solving are to essentially you want to base pretty much all your revision on doing question banks. So there's no point going to read textbooks for this section. You just don't have enough time. So you want to be picking good question banks that cover a broad range of topics and focus on the questions that you get wrong. I personally used flashcards. So if I got a question wrong, I would make a flashcard of it, and then I'll test myself on those daily so on the commute to work. As for the particular question banks, I will say that we're not sponsored by any of these people. Jakob and I both used Past Medicine and MCQ Bank, which we thought was pretty good, and a lot of people that I've asked have used similar question banks as well. I think one of the people I spoke to may have used Past Test as well, but the aim is to do one question bank completely so that you cover all the topics, and then move on to the other question banks. So Past Medicine is quite good because it's broad, it covers everything, and it's one of the cheaper ones at the time of the video. And MCQ Bank has questions that are quite representative of the exam. When you're going through the question answers, you also want to be looking through NICE guidelines and NICE clinical knowledge summaries. Although the test itself, they explicitly say is not to test your knowledge of guidelines, they're quite good because they tell you about the diagnostic and treatment pathways for many of the conditions that they talk about. So definitely worth referencing those guidelines and just being familiar with the basic diagnostics and management of the conditions. As for the revision itself, as Jakob said, start early, revise regularly, especially if you're working busy jobs, which many of you will be. Some of the people who did really well that we work with essentially didn't do any work shifts in sort of the month or 2 months before their exam because they were locuming. So they focused completely on essentially doing MSRA questions, and they ended up doing quite well. So be prepared to essentially just put in the hours and get through the questions. Another tip is that you're not negatively marked for getting questions wrong. So attempt everything. And the other thing to do just before the exam is, because it's sat on Pearson VUE, which is the software for the exam, you want to test it out beforehand. And on the website, they have a test environment where you can practice just familiarizing yourself with how the software looks. And there are some shortcuts as well. I think if you press Alt and N, you go to the next question without having to move your mouse and click. I mean, that might save you like a second or two per question, but it's more getting familiar with the layouts. And of course, read the question fully, which applies for any exam, really.
Now, professional dilemmas, the bane of this whole process. Okay, so 3 key areas that they're testing you on: professional integrity, coping with pressure, and empathy and sensitivity. So professional integrity obviously is about honesty, if you're a trustworthy doctor, if you strive for quality, and if you can manage the risk really well, and if you essentially prioritize and make patients, the care of your patient your first concern, and always open and honest. And the type of scenarios you'll get maybe things like you see your colleague stealing from the drug cabinet. What do you do, or how do you rank it? How do you rank this? What's the most appropriate and least appropriate thing to do? That would be in the professional integrity section. Coping with pressure, some of the questions will definitely ask you or assess you how you do well under pressure. There could be scenarios, for example, you're on the acute take, you have multiple unwell patients, and a carer or family member wanting to speak to you. How do you approach this? What do you do? Again, you rank, and I'm going to explain a very key method a technique that I use that I scored really well in. That it should make whichever scenario you're faced with should make it very easy and straightforward. And the last part, empathy and sensitivity. They want to assess, if you're an empathetic doctor, not only to patients but also your colleagues, and if you work well essentially in a team. There's two types of questions they will ask you. Half of the question paper on the professional dilemmas will be ranking question. Ranking questions, you'll get a vignette or a stem, and then you'll get the question. Read the question very, very carefully, because this can change and there are nuances that can happen that will change the whole answer. So it's very important to read the actual question that they ask. And then you get 5 options, A to E. There's a technique called or and technique. For all ranking questions, you use the or technique. Now, what do I mean by the or technique? Before I explain that, the top things you have to prioritize that should rank highest is number 1, patient safety, your health and well-being, and then your colleagues. So if any vignette that you get, there's a hint of patient safety involved or compromise of patient safety, you have to make sure you rank that top. How I tackle this question, especially in the ranking question, is I first of all look at read the vignette obviously, and then A to E. I look at which 2 options are the top most appropriate action to take and the least appropriate action to take. So you'd rank those 2 first, and then you've got the other 3 options. And here I use the or technique. So I say to myself, is A more appropriate or is B more appropriate? Is A more appropriate or is C more appropriate? You do that for each option given. If we read this actual question, so you are a foundation F2 doctor working on a busy orthopedic ward during an evening shift. One of the nurses asked to speak to you in confidence. She's concerned about one of your F2 colleagues, James. The nurse tells you that she has observed James making several mistakes today, and when she told him this, he burst into tears and said he couldn't cope with his workload. So here you can see you've got a colleague who's in distress, potentially patient safety concern again, and a colleague who's concerned. So how would I rank this? The least appropriate straight away that I can see here, that doesn't result. So the other thing you have to do is you have to look at the options that would actually sort out the problem at hand straight away. So the option that doesn't do that at all would be suggesting that the nurse advises James to make an appointment with occupational health as soon as possible. That really doesn't solve any problem here at all. It doesn't solve James's stress or the workload at hand, or doesn't give an appropriate answer to what's going on. So the one I would rank first is B, speak to James about the nurse's concern. So directly going to James and saying, what's going on, what's happening, and working ways on how you could sort of overcome the problem. So B would be first, and then C would be last. So I know that's I've set those 2. And then what about A, D, and E? Then I say, is B more appropriate or is A more appropriate? Now, to me, B is more appropriate because you're going to James and you're discussing the problem at hand and solving the problem. And then if we read A, discuss the distribution of workload with the junior medical team, that would be the next appropriate thing to do, because there's a lot of work going on. You're multitasking. What can you do as a team to resolve the problem and make James less stressed? So that'll be the next option. So the B, A, and we know C is last, and then you've got D or E left. So if we read D, suggesting that the nurse contacts your consultant to discuss her concerns about James more appropriate, or would it be seek advice from your seniors as to how to support James? So in the NHS, as you know, there's a way to work up escalation. So to me, E would be more appropriate over D before going to your consultant, because again, you're showing initiative and you're going to your seniors. So that would be the way I rank it. And obviously the last one, as I mentioned, would be C, going to occupational health, as that wouldn't really sort anything out for James. So remember the or technique. Is one option better or more appropriate, or is the other option more appropriate? And I'll also rank what's the most appropriate thing and the least appropriate thing top and last, number 1 and A and E, or number 1 and number 5, and you use the or technique to go through the other options. Also, when you're answering this question, you're expected to be you're seen as an F2 level. So if an option says gives you an answer which would usually a registrar would do, or a consultant would do, you would not choose that option. You have to look at it as if you're an F2, and what would you do from an F2 point of view? interview. So that's very key, because you do have some answers that would throw you off. And then if you go to the next type of question, so you've got the multiple choice. So you've got the multiple choice questions. So here you get 8 options, and you have to choose 3 options that gel together. And the technique I use here is called the AND technique. Which 3 options gel together, work best together? If we read the questions, the question: you are a foundation F2 doctor working in urology. You have just led a teaching session with the medical students. You had prepared a presentation, especially for the session. Your consultant tells you that the feedback from medical students was poor. Read the question, very key, read the question. Choose the 3 most appropriate actions to take in this situation. Reading through A to H, so I won't read all of them, you can read it by yourself, but the 3 that stands out most, and if we use and there together, that gels together best, would be B, ask the consultant for more detailed feedback. They've gone to your consultant has the feedback, you're approaching your consultant, asking what's happened, how you can do better next time. Ask your consultant to observe, so F, ask your consultant to observe you in your next teaching session. Again, that would work well together, they gel together. So you're asking for your consultant for feedback, and then you're following that up with a teaching session. Your consultant can observe you and give you further feedback. And then the third one would be G, include this experience as a reflective entry in your foundation portfolio. So this would be an initiative you're taking that would fit with B and F, because you're realizing the problem, you're trying to sort the problem out, you're also reflecting on it, if that makes sense. So that's why B, F, and G would be the 3 that gel together most. And I'm using and. So ask the consultant for more detailed feedback, and ask your consultant to observe you in your next teaching session, and then include the experience as a reflective entry in your foundation portfolio. Now, obviously, the answers, we don't have the answers for this from HEE, but from what I've revised and what I think is the most appropriate answer, this would be it. If you try and use that and technique for the other options, it really wouldn't work. It wouldn't gel well together. So for me, it would be B, F, and G. And the key take-home point for it is, it doesn't matter what question or the answers are, which 3 gel together if you use the and technique. And if we go back to the other ranking one, which from most appropriate to least appropriate, if you use the all technique, which options are the most appropriate and which ones are the least appropriate. So definitely read the Good Medical Practice guide done on the GMC website. That's key. Once you've done that, questions. I can't stress enough how important they are. One document that really helped me was the UKFPO SJT practice papers. I think that was really representative of the actual exam, and the answers they give at the bottom of each questions are really good as well, and allow you to really understand the way the examiner's thinking, how you should approach these questions. And also, don't dwell too much on the scenario, because you only have 75 minutes, you've got 40 questions, and believe me, that goes really fast.
And a couple of things I just wanted to add on top are that the difficulty with practicing for this section is that you don't know 100% if your thinking is the correct thinking. For example, if you do a question bank, the people who write the questions don't know either what's 100% correct. I mean, even the examiners themselves are not 100% sure. So what you want when you're practicing is to get answers with explanations that are completely validated by obviously the people who write the exams, and that's why Jakob and myself as well use the SJT practice papers, even though that was aimed at foundation score. The other resource that I used myself was Good Medical Practice in Action, which essentially scenarios, and they're free, where you work through difficult situations, say possibly ethical situations or angry patients, and they reference that to parts of good medical practice, so that you it's more to get your thinking aligned with the principles of good medical practice, which are sort of the guidelines that doctors use regarding their professionalism, etc. These are some of the links for the things that we've mentioned. As I said, they're on our website, aceradiology.com. Also make sure to join the mailing list if you haven't already for more. Let's have a look at some of the questions. So I'm just going to stop sharing my screen.
If you do have any questions, please do write it in the chat box. We're more than happy to answer anything at all. Do you reach out to us on Twitter, social media? Always happy to help. Do email us as well. I think there's a question coming. So when is the exam? The exam is between Jack, if you go back to that slide, I think it's between the 5th and the 17th of January 2023. So you've got that period to sit the exam.
And I will just say as well, the booking for the exam it's something you just have to keep a close eye out for, because one second, let's just show the dates. Yep, so the 5th to 17th of January is the dates for the exam itself. But I think last year was probably around the 20th or 21st of December. They may have told you when you've done your application when the invitation comes out. But essentially, radiology tend to invite people quite late to the exam. The exam is sat by lots of other specialties. So we're talking GP, neurosurgery, everyone.
Yeah.
And because, well, my theory is that because this was originally a GP application exam, they find out first and the other specialties find out later. Essentially, all this means is when it comes to the date where booking opens, what people have found is that if they log in before they're told by HEE, sometimes they can actually book the exam before they're invited. And what I think that is for example, the booking invitation has been emailed to, say, the GP applicants, but it hasn't yet got through to the other specialties. So it's worth just logging in on the day, or even in the days up to the booking date, to try and book your place. And the reason is because all the good places will go quickly. So by which I mean the dates that are at the end of the exam period. So you can get yourself an extra, looks like 12 days of revision if you book at the end. But also you don't want to be doing this exam right after some nights. So that is quite important, because I was on intensive care when I sat this exam, and I managed to not do it right after a night shift, because that will impact your performance.
So we've got another, thank you for that, Jack. So we've got another question. Hello, thank you for the webinar. Where do we take this? So as we mentioned, it's in the Pearson VUE Examination Centre. I understand you have to look at the Pearson VUE website, but sometimes they allow you to do it from home under exceptional circumstances. I don't know if that's changed. You have to go to the website to confirm that, or email the recruitment centre. Someone else has said, I heard the first 55 candidates with the highest score in MSRA. No, that's gone. So that doesn't happen anymore. For specifically for radiology, this business of for the first 55 candidates scoring highest, that was in previous years. That will not be happening this year. Our questions same in exams? No, they're different. Every day or even like everyone else you're sitting with has different questions. So the questions are different.
Yeah, so just to expand on that, essentially the MSRA questions are in a big pool, and you can get questions from within that pool. So that's why you may not get the same questions as the other people, but they only pick questions that have been validated through testing to include in this big pool. How can I be invited for the exam? So you're invited when you submit an application for a specialty that uses the exam. So for example, you have to apply for radiology or apply for GP specialty training in order to then get an invitation to sit the exam. So it's not like the MRCS where you pay money and then you sit the exam. For this, you have to done an application through Oriel. Is there any good mock exam that you can recommend, which would be used to predict our current level during preparation? So there's different options. There are some example questions, I think, on the GP recruitment office with, I think there are some with answers in them as well. So that is one way to get probably the most accurate gauge on how you're doing. The other way is when you do the question banks, you can sit it like a mock exam. So you can pick to do all topics and time yourself and do a certain number of questions. And then you can compare that after a couple of weeks of revision and see if you're generally doing better or not. Those are probably the best ways, unless you can think of any others, Jakob.
No, that's correct. It's just you do the mock exam from the question bank. So can we apply for radiology next year with this year's MSRA score? No, you cannot. Every year you have to reset it if you're applying for that year. So you cannot carry over scores.
Yep. And I think it's even every half year. So not for radiology, but for GP, they tend to do a February entry. And I believe you can't carry your score from the February one into the next August application. So you end up sitting it more than once, which in some ways I guess can be an advantage because you end up getting more practice at the exam. I mean, I sat the exam about 3 times. On the actual exam day, which section comes first? I believe it's professional dilemmas from memory. So you get more time with the professional dilemma section. You get almost a minute per question. And then for the clinical scenarios, you get almost about half a minute per question. So I remember rushing at the end to try and get through those. So I think professional dilemmas does come first, and that is listed in the MSRA blueprint. The link to that again is on the website.
What were your revision schedules whilst working in the lead up to the exam? So to be honest, I don't know about you, Jack, but I personally did a bit of revision every day, at least a couple of hours every day. I started 3 months before, but the last month was really hardcore revision, and the last week or 10 days I took leave and I was just revising non-stop, essentially. That's what I personally did.
So and what I did is this is partly because I was a bit cynical, because I did surgical training before, so I'd forgotten loads of my medicine and things. So basically I started about 6 months before, but I revised really infrequently, so it wouldn't have been every day. And then when I came up to maybe about 2 months before, I started to ramp things up and do some every day. And the important thing is to try and be really consistent if you can, and just squeeze in that, even if it's just an hour of revision, it'll make a big difference. Or if you're doing flashcards on your night shifts, just squeeze it in somewhere, because if you leave it 2-3 days, you then just lose momentum. And then the other way of doing it, which I mentioned with some of our colleagues, is that they essentially just didn't work for a month or two before the exam itself at all, like no shifts at all, and they just went through the exam questions like crazy. Is there a number limit, like the PLAB, for taking this exam? If we're not prepared well, do you advise to take it?
As far as I'm aware, there's no number limit. And if, say, you sit the exam, you find out your result, you can withdraw from the application process. The only time it has a consequence is only if you're given an offer and it's close to the time of the job's actual training starting, and then you say you can't, you reject the offer or you withdraw, then it may be a problem. But just sitting the exam and before getting an offer, withdrawing is fine. You won't have any issues there.
So I agree, definitely. I would definitely advise to take it, partly because you never know, you might do well enough to get an offer, and secondly, even if you don't get an offer, at least you've had the practice and you're used to how the exam runs, and like the layout, the computer, and some of the topics that come up. So definitely I always say definitely worth giving a try. To be invited this year, is there a window period to submit applications to be invited? So that period has closed for the exam sitting in January. They closed at the beginning of December. So the next application would be, I guess, for February 2024 jobs, which means the exams are normally sat around September. I think that's when I sat mine last year, and normally the applications for those open in the summer. I can't give you an exact date. They should be on possibly on Oriel, or if you Google say GP application timetable, they'll give you a date. I think it's around June or July that they invite you, that you can apply, and then sit the exam in September. And as I said, everyone, there's left lots of information about preparing for the MSRA and links on our website, which is ace-radiology.com. And make sure you join our mailing list, because we will be posting out some tips. And also, when it comes to the interview, invites for radiology, we'll do an interview webinar as well.
Exactly. And just before we end it, I just want to emphasize, especially for the professional dilemma, do consider using the or and technique, because it really does help. Thomas asked, how many jobs do they tend to advertise for Feb intake? Which specialty? Because it depends which specialty you're referring to. Radiology, I don't think radiology has a February intake this year. There was a weird March intake last year, but I don't think that'll be repeated as far as I'm aware. But I know for GP and psych and anesthetics, there is a Feb intake.
I'm just trying to remember when I applied for GP, how many jobs there were. I think there must have been about 100 from memory. So definitely not anywhere near as many as the August intake, but you'll get things pop up. For example, if people go on either go on maternity leave or go less than full time, or if they complete their training, that frees up a space. Then that's the reason why you get new jobs being created. If you ever wondered why they add some later. Good, right, we'll call it a day there. You can always ask any more questions to us through Twitter, Instagram. Check out our interview webinar when that comes out. And if you haven't already, also our portfolio webinar, which you've seen before. So thanks for coming along, everyone, and really good luck for the exam. You've definitely got enough time to prepare. Take care, everybody.
Take care, guys.